I'm Clemma Nash. I'm from Western Wisconsin Health, and I'll give you a little more details in a minute. How's that? First off, my topic is mold, a hidden barrier to recovery. At ILADS, which I want to thank you all for sending me, because it was an amazing experience. I was totally overwhelmed having not been to that, and I think that, was this their 15th or 20th? I mean, they've been doing it for a while. So I feel way, way behind. There's so much to learn, but it was a really amazing experience, and they spent one whole afternoon talking about mold illness. So I thought it would be helpful to bring this to the group, if you don't already know about it, to just bring it to light. I also want to thank Richie Schumacher. I don't know if you've heard of him, surviving mold. He was the pioneer. And in medicine, it takes about 20 years to go from studies and science to actual practice. I would say probably more than 20 years, right? So he was amazing. Back in 2005, came up with the idea that maybe mold isn't just about allergy for people. Maybe it's a toxin for your entire body, particularly from the Lyme perspective for your immune system. Neil Nathan, if you haven't read this book, Toxic, I suggest strongly that you read it, because I bet you will see yourself in it if you are suffering from Lyme or any chronic illness. I am in a mentorship group with Dr. Nathan and learning every time that we meet more and more and more. He's been doing this for years, and he's amazing as well. A representative from each of these kind of camps, because they do treat this, they treat mold illness a little bit differently, each of them. They spoke at the afternoon breakout session at ILADS, and also Jill Krista, who wrote this book, Break the Mold. She is actually a naturopath in Janesville, Wisconsin. And her whole family suffered from mold illness. So this is her journey into the science of it all and how to treat it. And then, of course, I have to thank my patients, because every day I learn from them. The questions, the issues that come up, always a learning experience. And also, I want to thank the CEO of Western Wisconsin Health, because she is a staunch supporter of functional medicine. And you do not find any functional medicine physicians in an insurance-based practice in this town. Maybe there's a couple, but mostly no. A little bit about myself. I am board certified in family medicine and board certified in integrative medicine, just like Dr. Zenker. And I'm practicing in Roberts, Wisconsin. I'm just doing functional medicine, so I'm having people with chronic complex illness come to me after they've been through the mill, you know, after they've had the Mayo workup, the $1 million workup and whatever, and then we proceed down a functional path. So it's fascinating, it's always a puzzle, it's a detective game, it's a lot. So here we are, chronic illness, like having tacks in the bottom of your shoe. So what can you do if you have tacks in the bottom of your shoe? Well, you can take pain medicine to help the pain in your foot, right? Or you could take out the tack. So what we want to know is mold a tack in your shoe. How many of you know about mold illness? Am I preaching to the choir here? Few people. Okay, fair number. So we're just going to go over some basics tonight, and then time for questions. So let's see here. This is different than my usual setup, so I'm struggling a little bit here. 1 in 4 buildings are affected by toxic mold. There's no standardized treatment programs. It's not just old homes. There is no smell from toxic mold. Everybody says, oh, you have to walk in and it's musty and icky in there. No. And it often results in very strange symptoms that really perplex doctors. There's this saying in medicine, oh, they have a diffusely positive review of systems. That means every single system is involved with at least a couple of symptoms. That's what a mold patient, that's what a Lyme patient looks like too. And nobody knows what to do with that in the 7-minute visit, right? When you go to the regular doctors. So mold is the ultimate survivor. It can grow inside a building undetected. It can survive on hidden moisture sources. Any dust feeds the mold, so if you're not a great housekeeper, that can be an issue. Mold is a fighter. It will emit toxic chemicals when threatened, and it's very tenacious. When it's threatened, it also shoots out spores, little baby molds, all over the place. It emits these toxic gases called mycotoxins. Mycotoxins are actually used by the military as a weapon. So that's really, really frightening that they are that strong and that serious. Indoor molds release these gases when they're competing for territory against other molds. Mycotoxins have no sense. And not only are mycotoxins pumped out, but other chemicals like VOCs, aldehydes, alcohols, these can be trapped behind building materials as well. Most of you in the Lyme community know about multiple chemical sensitivity, right? So all of these things, imagine what they're like if you're living amidst those on a 24/7 basis. Mold is the gun, mycotoxins are the bullet. Let me just get this moving forward. I have patients tell me, oh, I just have a little bit of mold on my windowsill. Indoor mold is never okay. Outdoor mold, that's a different thing. But indoor mold is putting out these toxic chemicals that you're breathing in, that go in through your skin, that are just poisoning you, basically.
So if you clean it up, is it gone?
It depends on how you clean it. Yeah. And you, if you are suffering from mold illness, should not be doing the cleaning at all unless you get in those whole hazmat gears, which we're seeing a lot more of lately. But, and everybody says, I'll just take a little bleach to it, but bleach actually makes the mold spores go around more. So bleach isn't the best thing. Everybody reacts to mold differently. Also a difficult issue because I often get couples in. The husband thinks the wife, and it can be reversed, but this is mostly the way it is. Husband thinks the wife is crazy. You know, why are they feeling like this? No, I'm having no problems at all. Or we don't need to spend the money to remediate or clean up anything. It's not a big deal. Whoops, sorry. So not everybody is susceptible from the get-go. Given enough duration of exposure and enough dose of exposure, everyone will be affected. But genetics impacts, your overall health condition impacts. If you're a canary, you know, the canary in the coal mine, you're going to respond much more quickly to the negative effects of mold. And we'll talk more about mold allergy and mold illness later. Mold invades your body. So just because you leave the building, you don't leave the problem behind. It can affect biofilms. You are probably familiar with the term biofilms in the Lyme community. Well, there are biofilms in your sinuses, your lungs, your digestive system. Mold can get into those and colonize, meaning it's living in your body. So in the treatment process, we eventually get to treat colonization if needed. Mold weakens your immune defenses. You may get sick more often, or you may not get sick at all because you can't even mount an immune defense. Your body can't detoxify as well. That's what I mean by cleaning up the garbage. So eventually, if your detoxification is poor enough, that can lead to cancer. Chronic viral infections can develop. You hear about chronic EBV, right? Maybe you've heard that, Epstein-Barr virus. And your doctor can't find a reason because they're not looking for these kind of things, and we're not taught about these kind of things in medical school. Mold increases your cravings. I can't tell you how many people come to me and say, I just can't get off that sugar, you know, or I have such bad cravings. Well, mold loves sugar. Alcohol is one of its favorites. Any sugar will do. It doesn't matter. And if you don't eat the sugar, Mold's going to get ticked off and it's going to start dying and emit these toxic gases, so then your cravings are worse. Then you go and you eat something and you feel better if you eat some sugar because you're feeding the mold and it's happier. Quite a process, right? The only way to get rid of that is to treat the mold. Mold can cause food sensitivities and food allergies. If somebody comes to me and they just developed allergies at age 35, I'm going to be thinking mold. Things like SIBO and irritable bowel and all those things can be potentially caused or worsened by mold. Mycotoxins are found in most grains and may be contributing to some of the grain allergies and intolerances we're seeing. How many people are on low gluten, no gluten diets nowadays, right? There's a lot of reasons for that, not just this. I think the glyphosate they spray on the wheat may be more of an issue than the actual grain, but that's a whole nother conversation. Mold makes you super, super sensitive. So are you one of those people that walk down the laundry room to a laundry aisle in the grocery store and have to walk the other direction? I think of it, all of us, as a bucket. So we're all like a bucket. We live in a toxic world. There's no doubt about that. Well, some of us have really good spigots on our buckets. Other people don't have such good spigots. And some people, they're really careful about how many toxins come into their body on a day-to-day basis, and other people aren't. And then you add mold toxins on top of that. So pretty soon, that bucket is overflowing, and you can't empty it. So you don't detoxify as well. Then other chemicals come in, like, scented products, all those kind of things. Those are chemicals, and you just can't deal with them. That's how multiple chemical sensitivity can develop. And then the elephant in the room, and that is Bernarda's, Dr. Zenker's comment about EMF, the elephant in the room. Everybody's aware we're going to 5G, right? All of this stuff is coming. There are people that don't handle all of this EMF well. Mold is one of the things, mycotoxins, the production of mycotoxins from mold increases 600 times when exposed to EMF. And that's just one little piece of the whole thing. So who knows what's going to happen with all that. Some people are just more sensitive to electric currents and have a harder time being around them. So things like turning off your Wi-Fi at night, getting a timer on your router, things like getting rid of your smart meter, certainly not sleeping with your cell phone. All of those things are really important for people with Lyme and mold. Mold illness is very misunderstood by the traditional medical community. They recognize mold allergies, which is basically the spore sickness, and that's usually in the respiratory tract. But mycotoxins are a much bigger problem. They're much more damaging, and they affect not only the respiratory tract, but your brain, your bone marrow, your bladder, your nerves, your kidney, your skin, intestines, the whole shebang. Mycotoxins affect us in multiple ways. They cause inflammation, they damage the mitochondria, they impair the synthesis of RNA and DNA, they deplete glutathione, which is one of your major antioxidants. They are a poison to nerves in the body and in the brain. They're toxic to the liver and the kidneys. They impair or inhibit our immune defenses, and they actually can get into the hippocampus, the memory center in the brain, and cause dementia. So pretty serious stuff here. So you've got the spore symptoms, you've got the mycotoxin symptoms, and that's what's known as mold illness. There are other names you might have heard in your reading on the internet: toxic mold syndrome, biotoxin illness, chronic inflammatory response syndrome, or CIRS, mycotoxicosis. They are all referring to the same thing. So the mold illness symptoms, they can be wide-reaching, vague, multi-system, multi-symptom, and there's no one symptom that says you have mold illness. The other issue is these symptoms can come up months after exposure, even years. So a house you lived in 2 years ago could still be affecting you. So some people say, just give me a list, all the symptoms. Well, I gave you that questionnaire when you walked in. That actually is a pretty good list of things, but I'm going to go over the different systems here so you can just see how many of these you have. It's never just one thing. Eye, ear, nose, and throat symptoms, hearing issues, swollen lymph nodes, chronic sinusitis, allergies, hay fevers, shortness of breath, dry cough, heaviness in the chest, smoke sensitivity, colds go easily to your lungs, digestive system, things we talked about, irritable bowel, even cyclic vomiting syndrome can potentially be mold. Circulatory system, so low blood pressure, Raynaud's phenomena, irregular heartbeat. Let's keep going here. Skin, of course, rashes, fungal infections, but even sunlight sensitivity can be a symptom of mold. For brain, memory loss, word finding difficulties. Are you familiar with Dr. Bredesen that wrote the book, The End of Alzheimer's? Anybody familiar with that? Well, he talks about inhalational Alzheimer. That is the effect of mold on the brain. Nervous system, neuropathy, tremors, seizures. Are some of you seeing the similarity between this and Lyme? Urinary symptoms, bladder infections. Immune system, this is a big one. Increased susceptibility to cancer, chronic Epstein-Barr, increased susceptibility to infection, and even the reproductive system. We have an epidemic of infertility now, and maybe one of the reasons is exposure to mold. Mold and Lyme, we talked about it, have similar symptoms. They both like to imitate other conditions. They make pre-existing illnesses worse. They can alter your response to treatment. We call it paradoxical reaction to medications. So I have had patients that I give a sleeping medication to, or an herb even, and they are up all night. That makes me think, could this be mold? Could this be Lyme? They both impair the immune system and they increase your susceptibility to each condition. If you have mold, you're more likely to have Lyme. And when I say Lyme, I mean all the tick-borne illnesses, not just Lyme, not just Borrelia. So what is different? Mold symptoms don't wander. Dr. Horowitz taught us that Lyme symptoms, you know, you've got pain in your knee one day, and the shoulder the next, and the next day. Mold symptoms don't do that. And mold typically affects the respiratory tract more, but I tell you, I have a lot of people with absolutely no respiratory symptoms. They've just got the brain fog, or the fatigue, or these strange symptoms that nobody can figure out. Mold illness needs to be treated first prior to Lyme. That's the big message here, because most experienced practitioners agree with this. Mold must come first because you have to get your immune system back online. Your immune system, some people are saying we all have Lyme and all these bugs in us, but if you have a healthy immune system, you're doing okay with them. But when your immune system gets so compromised like mold can do, you can't respond to the bugs. Let's see. Is there a test for mold illness? Not that is sensitive and specific enough. There are things that we do to zone in on it, for sure. Visual contrast sensitivity test was recommended by Dr. Shoemaker to start with. It's actually a test developed by the military to detect these mycotoxins in their recruits. And it's a little thing you do on the computer. It takes 10 minutes. It's sensitive, but it's sensitive also for Lyme and heavy metals. So if you're positive on that, we know we're looking for one of those things, but we haven't narrowed it down to mold. The questionnaire I gave you, Jill Christa's mold questionnaire, again, if you have Lyme, you may test yes on that one. So it's not a perfect. Neither of those are perfect. Urinary mycotoxin testing, that is the one that Dr. Nathan and his group uses much more than anything else. Basically, we're testing to see if you excrete the mycotoxins in your urine. And if you do, there's a pretty good chance that you've got them in your system and we need to treat them. Dr. Shoemaker has a list of lab tests a mile long. They're very expensive. Most of them are rather nonspecific, just looking at your immune system function. And they aren't as good as he would like you to think they are. I guess that's my conclusion on these. He was very big on HLA testing. I don't know if any of you have read about that. It's genetic testing to look for the dreaded gene, which means you're more susceptible to Lyme and mold. Well, that really hasn't panned out. One of my worst mold patients doesn't have that gene at all. So there's more questions than answers right now when we're talking about mold illness. But let's say it does look, from what we've gathered, like it might be mold illness. Well, what can you do? Well, first, you need to avoid. You need to avoid that building that isn't healthy for you. If possible, get out. Don't take anything with you, because all your possessions have those mycotoxins on them. And avoid further exposures. Not so easy, right? It's a big deal. So if you can't, you do the best you can. But it's a big problem, and you're outnumbered. 1 square inch of toxic mold contains 1 million spores, and every day those spores are putting out balloonfuls of mycotoxins. So imagine how significant this is for you in your environment, especially if you have a lot of territorial mold. I had one patient who was just fatigued for the last year, couldn't understand it. Yeah, getting a year older, but couldn't figure it out. We got suspicious for mold. He had somebody come out and look. His whole bedroom wall, behind the wall, was Stachybotrys, which is the black mold that is so terrible. It was from a leak, a small little leak they didn't know they had in the roof. So they completely remediated that, but 8 hours a night, he was sleeping with his head up against that wall. So big, big problem. The next, oh, did I miss a slide? Yes, inspection. So inspection and testing would come at some point in your process. You need to find somebody who knows what they're doing. And let me tell you, that's not easy either. If you do a do-it-yourself test from the big box stores, they catch only 10%. Now, if that test is positive, you know you have a problem, right? But if it's not, where do you look? And even if it's positive, how do you know where the problem is? Because most of the time, this water damage is hidden, and you have no inkling. So find a good inspector, and then find a good remediator. Very, very sad thing, 1 in 3 remediations have to be redone. So when they remediate, the moisture source is corrected. So if you have a leak in your roof, that's done or fixed, and the sick materials are removed. So anything that is wet or even moist is pulled out. Any visible mold, boards or whatever, is removed. And just make sure you have somebody good, and hopefully you have time to test before you rebuild. Air filtration is not a replacement for remediation. And I have a number of people that's all they can do right now. You know, you put a good HEPA air filter in there because they live in apartments. They have no control over the building. But it's not the best solution, but it may be the only solution viable at this time. The other thing we need to remember when you remediate mold is it's like skin cancer. You want to take out more than is necessary. We call them clear margins. When you take out a little piece that looks like it might be cancer, you always take out a couple millimeters beyond that so you can make sure and get all the damaged tissue. Same thing with remediation. You take out more than you think you need. CPAP machines. If you have CPAP, make sure you're cleaning your machine properly. Dr. Krista, in her book, tells a story of a woman. Both she and her husband, in their 80s, have CPAP machines. She cleans her husband's diligently every single night, or morning after using it. But, she doesn't always do so good with hers. Well, pretty soon she starts developing memory issues. And Jill somehow got involved with this family, went in, searched all around, and realized that she had mold growing in her CPAP machine. They corrected that, and her memory started coming back. So pretty good lesson with that one. So what about your internal environment that you take with you wherever you go? You have to do some avoidance and remediation there as well. Some people talk about a low mold diet. It looks kind of like a low yeast diet for those of you who have dealt with candida. You're avoiding obviously moldy things like aged cheeses, peanuts. You know, peanuts have aflatoxins on them. We feed our kids peanut butter all the time, right? We're feeding them mold toxins. But that's another thing. You want to avoid the simple carbs, corn, potatoes. These are foods that are particularly known for having mold. Beverages, particularly alcohol, coffee is known to have mold on it too. So you have to get mold-free coffee, organic, mold-free, free-range, whatever, coffee these days. So kombucha, potential source of mold. Now, a lot of people feel a lot better when they reduce those foods or eliminate those foods in their diet. Some people have to eliminate all fruit, all grains, all fermented foods, anything made with sugar or vinegar. So pretty drastic changes to their diet. If you feel better avoiding these, there's a good likelihood you may have candida overgrowth, which can happen in the Lyme community. You're probably familiar with, you know, a lot of antibiotics can cause yeast overgrowth. Well, in this case, we all have yeast growing inside of us. It's part of our normal flora, but it gets a little crazy when it's given, when you take antibiotics like for Lyme, or if you have mold, it starts growing and growing because it wants to outcompete the mold in your body. You have to be careful with certain supplements. Some people believe this, some people don't. So, but just know that many antibiotics are actually mycotoxins, right? Penicillin, the mold, grown off the mold. Some supplements are fungus, Saccharomyces boulardii, you may have heard of that. Some supplements are grown with yeast and mold. And antifungal herbs and antifungal medications, your body, you can't just go at this full force right away. It's slow, 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 because if you do, the molds are just going to go crazy, or the mycotoxins, and you'll be 5 steps behind. Dr. Nathan talks about that a lot in his book. He talks about tiny baby steps, because if you start going backwards, it's going to take you that much longer to move forward. Always look at the hobbies and habits if you have mold illness. So, do you like to bake bread? Do you like to brew wine or beer? Do you like to go to thrift stores or go into antique stores? Those are mold heavens, right? So just be aware that some people do need to change some of the things they're interested in. So you've inspected, you've started the remediation process, you know that mold is an issue for you. Next, we have to focus on the fundamentals, and this is with any chronic illness, not just mold illness. You have to get sleep. That is where you restore. Sleep is number one. Need to manage stress. We all have stress, but we figure out how to limit its effect on our system. Healthy foods, veggies mostly. Are you familiar with the Walls protocol? So Dr. Walls had MS. She was so bad. She's an internist in Iowa. She was so bad, she was in a reclining wheelchair. That is the only way she could get around. She couldn't even sit up in a wheelchair. She had to be at like this level. She still did her rounds on her patients, and she started getting into functional medicine and nutrition, and she read and she read and she read. Now she has cookbooks and books and retreats and all of this. But her big thing is you've got to eat a ton of veggies. She's fine, she wants you to eat some protein, but she wants you to have 9 servings of mostly veggies a day. 3 servings of cruciferous vegetables, 3 servings of leafy greens, and 3 servings of bright, colorful vegetables. And that is the mainstay of her healing, and now she's walking around with no symptoms of MS. So pretty amazing. Food is our medicine. Movement, important, but you may not be able to do a lot, so you take it slow. Water, you've got to drink to get those kidneys excreting the toxins. Breathing fresh air, getting outside, seeing the sunshine, and you gotta poop. So you detox by breathing, pooping, peeing, and sweating. And if you're not doing those, you're not ready to move on to the next step. So layer 1, avoidance. Layer 2, fundamentals. And now moving on, protect. You've got to protect all the different systems of your body. We talked about how it affects every single system. You've got to work on protecting that from being more damaged from any mold toxins. We use binders. Binders are things like activated charcoal, bentonite clay, zeolite. Cholestyramine is the original one that Dr. Schumacher used. Basically adheres to the toxins in the colon, and you poop them out. So that's why poop is important. We use things like bile movers, and the naturopaths have really taught me a lot about bile and how important that is to get that moving. Things like bitters. Have you heard of bitters that you put under your tongue before you eat? They're amazing. Protecting the brain with DHEA, milk thistle protecting the liver, turmeric, just altogether a good anti-inflammatory. Did I lose something? Something went off here. So all those are important for the protection phase. Then you move to the repair phase. Slow and steady wins the race. Sauna, great for detox, lymphatic massage, colorful fruits and veggies, glutathione, because you're so depleted in the glutathione from the mold, melatonin, coenzyme Q, the list goes on and on. And then finally you get to the fight phase. You might not need this phase, but I like the way Jill Krista talks about it. She says this phase is like cleaning a bear cage with the bear still in it. And you have to remember never to poke the bear. Because if you go in with your high-powered antifungals, either herbal or pharmaceutical, or you're just going in there with biofilm busters, you're gonna regress. You have to be ready for that, and you have to start very slowly for many people. And that's where having somebody who knows about mold illness can help guide you through this process. And finally, also, Jill Krista talks about fighting mold is like fighting zombies. Just when you think it's all the way dead, it can surface again. I can tell you, I've gone to probably 6 conferences that have something to do with mold, not directly, either mold and Lyme or mold and something else. And many of the presenters themselves are susceptible to mold, and they will get brain fog. They will just go around saying, I know this building is moldy, where is it? They have their antenna up. They are the canaries, and they know that mold is an issue, and then they know how to deal with it at that point. They've been through the whole process. They take their binders, they get out of the building after the conference, and all is well. So could dealing with mold remove that tack in your shoe that will help you deal with the other health issues that are challenges for you? Something to think about. And I always have Quincy make an appearance. This is Quincy, this is my golden doodle. He's reminding us that don't get discouraged. The road is long and it can be windy, but you gotta persevere because you can feel better. So there you go. I don't know how to turn this off, so questions, any questions? Oh, I should probably stay up here, right? Sorry. Questions?
Well, do you know any, or how do you find people to test your wounds?
That is a challenge. We have 1 or 2 people that we trust that I think you have to do your due diligence. I know Kathy Moore uses somebody on this side of town, or not this side, where are we? White Bear, on her side of town. Green Solutions or Green Home Solutions, I think. I haven't used them. We have somebody over in Wisconsin. I call this the wild, wild west, you know. You just don't know, my person who had the stack of mattress behind his wall, he called some furnace company and they did a fine job, you know, so I don't know. I wish I knew more about that end of it, and I don't. We have a remediation, AdvantaClean over in our area in Hudson. They do a great job with the remediation, the tearing out, and I had a roof leak last winter, and I had a laundry room leak this fall. So I am really getting experienced about calling these people. But every time I learn a little more, but it's a mess and it's not fun. And many people, you know, that are dealing with chronic illness anyway, they don't have funds to do this kind of stuff. And I have one person on disability, and she, you know, she said, should I move to another apartment? And I go, wow, you're just going from the frying pan into the fire sometimes. One of my patients actually did do that. They were, I forget where they were, but they had some mold in that house. They ended up moving, and now it is so much worse because the people didn't disclose. And so, and she is really ill from it. So it's tough. But there are people that do a reasonable job. There are also IEPs, that's what they're called, Indoor Environmental Professionals. There's several that are always at these conferences. They were at ILADS. And they actually will do a video look at your house. And so you can get long distance kind of things. They're not going to do the rebuild or the remediation, of course, although some of them do send out people to do that as well. But you know that's going to cost quite a bit.
So if you have it in your house, how do you, okay, you do your remediation, but what about your furniture?
Yeah, that's a whole nother thing because, are you familiar with Jill Carnahan? She writes a lot of blogs. She's an MD in Boulder. She had breast cancer when she was 24, then she got ulcerative colitis or Crohn's, I forget which one, and then her office flooded and she got mold illness. I mean, she's been through it all herself. But she talks about that a lot. I have some handouts I give people because she had to throw away all her charts. Somebody had to Xerox them for her, whatever they call it nowadays. I'm old, so I call it Xeroxing. And she had to throw away all her books because paper just holds on. Upholstery, it's dependent on different things. There's some guides out there to help you clean, but it's a huge deal.
Does it wash out of clothing?
I think so, but it has to be clothing you can wash vigorously. I'd have to look that up, actually. I'll look that up.
When somebody asks a question, could you repeat it?
Oh, I'm sorry. Yes, absolutely, sorry. She was asking about what you do with furniture and clothes with that question. So there are many guides out there that I hand out to people. I have one patient who actually had to move out of her house with her husband because they bought a 100-year-old farmhouse. You know what that meant, right? And she rents an apartment. She had to buy a new car because her car was contaminated, and she had to buy all new clothes. So you can see how devastating it is.
Like, how does it actually, like let's take the lungs. Like, how does it actually damage the lungs or, like, cause the shortness of breath?
Well, it's a toxin to your cells. So your cells, you absorb it either through your skin or you breathe it in, and it gets, she asked, how does it damage your lungs? And then it affects the internal mechanisms of your cells. The mitochondria are the powerhouses of the cells, your DNA and RNA, so how your cells make protein. So I think it depends on which cells you're talking about what the manifestation for that particular organ would be. But you can see it can cause multiple different symptoms just depending on your genetics to some degree, what your underlying illnesses are. Certainly if you have lung disease, it's going to make that worse.
And like when you do the testing and you use the urine test, so does that mean, like with Lyme disease, we have it, in the tissue and in the cell, outside of the cell, in the
Oh,
blood. I mean,
yeah.
it kind of has lots of different.
I don't think mold is like that. It's not like Lyme, and there's an intercellular bug, and there's an extracellular bug, and there's persister bugs. It's not like that. It's a toxin that is like a poison.
It's a poison that the body has to react to.
And it reacts by different mechanisms, inflammation, what else was, that's a big one. But it's not the kind of inflammation, you know, swollen red like a sore thumb or something. It's an internal inflammation.
Internal, like in the organs. And so the inflammation can happen in the lungs, probably.
Well, I think some of the lung symptoms and respiratory symptoms are due to the inflammation. Coughing itself can be related to inflammation. Mucus production related to inflammation. Again, I'm still learning. And the afternoon at ILADS was great in that we got to see all the different points of view out there on this and how new it is and how challenging it is to deal with. So.
And the correlation between Lyme and the mold is because it's an opportunist toxin, and so the Lyme, like they kind of both live together, and if they have the mold, maybe if you didn't have Lyme disease, you might be able to detox the mold and be fine.
Perhaps. I see, she asked about the correlation between Lyme and mold. I think the biggest intersection of those two is the immune system and the effect on the immune system by the mold. And if your immune system is basically paralyzed in some ways or not able to function optimally, which happens with mold, and to some degree, right, with Lyme, then you're going to be more susceptible to many things. But often mold, illness, and Lyme coexist for people.
And one of the things on your slide said that you could either get sick a lot or you don't get sick at all.
Yeah, some people, so about either get sick a lot or not at all. There's some people that say, oh, I'm so great, I never get sick, you know. It may be because you don't have a very responsive immune system, because part of the way an immune system responds to bugs like viruses or bacteria is that it puts out cytokines, and cytokines are what causes all of the symptoms of like the flu or this new virus. It's all a cytokine storm is what they call it if it's bad enough. And that causes inflammation and, you know, feeling achy all over and all of those things. Well, if your immune system can't even mount those fighters called cytokines, you're not going to feel sick.
But
So-
you would still have.
But you could still harbor the virus or the bacteria or whatever. One of my patients was so excited because she got a cold. After so many years, she was actually getting a cold. She thought, oh my gosh, I have an immune system that works now. So.
I'm looking at your dog up there and wondering if you have mold in your house, can the mold be in your dog?
Yes, she's asking about whether mold can be in the pets, and I think that is a yes. I've read that. I can't remember all the details right now.
What do you do about that?
I'm not sure. Giving them shaved and clean them off. Yeah. So I know they can have fungal infections on their skin and that. I don't know if their bodies harbor the mold toxins like we can. I'm not sure about that. Be a good question for my vet. Yes, sir.
Can you review the diet again, please?
If I can see the slide, I can. Basically, it's avoiding, he's asking about the diet. Basically, it's avoiding carbs, sugar, and fermented foods. So things that are like alcohol, kombucha, those kind of things, sauerkraut. All those things are, have more of the yeast and molds in them. Now, not everybody talks about this diet. Dr. Shoemaker doesn't really talk about that. Dr. Nathan does talk about a lower carb diet, but Dr. Krista talked a lot about diet when she talked at ILADS. So it kind of depends on your perspective. I think just for anybody, reducing the simple carbs in the diet, you're doing a big job of reducing the food for the molds.
And it was avoid the fruits.
Well, certain fruits for sure. I mean, have you ever gotten a bunch of grapes and they're all moldy, right? So grapes are something that mold would grow on easily. For some people, you've probably heard of the keto diet, right? So for some people, they do very, very well without carbs, and fruit are carbs. In fact, something I was listening to recently said, fruit is nature's candy, and we shouldn't be eating candy. Now, it comes with a lot of good things like phytochemicals and antioxidants and all of that, but maybe if you're dealing with mold illness, that those extra carbs, even in the form of, you know, beautiful, colorful fruit, might not be good for you. I'm not saying everybody needs to do this restrictive diet, but for some people it could be beneficial.
You know, having Lyme for so many years and the antibiotics, and I thought like kombucha and sauerkraut were beneficial for your...
Well, they are, and they can be, and I'm not sure I agree 100% with what Dr. Krista presented that afternoon, because I think some of these things are good, but if you read Dr. Wall's book, The Wall's Protocol, she talks about, she follows basically a keto type plan with a ton of vegetables. And she talks about the research that shows how important all of that is for the microbiome. So the kombucha, I think, personally, I think it's all sugar. And it may not, you know, yeah, it has some bugs in it, but, you know, is it enough? In fact, I listened to an expert on the microbiome. He's out of Australia. I forget his name right now, but he was talking about all of these things. Yogurt, kombucha, all of that really doesn't have much in the way of microbes in it. So you're better off taking a probiotic that has 50, 100 billion in it rather than drinking 5 glasses of kombucha. In the old days, maybe it worked, you know, when people had root cellars and they made their sauerkraut and everything, but they didn't live in a toxic world like we do. So I think that's the big difference, that why all of a sudden are all of these things coming to the forefront? Well, we are just overloaded. Other questions, comments?
The outside mold.
Yeah.
I mean, we're probably surrounded by...
Yeah, and that's, you know, it's not confined. Our houses are built so tightly nowadays that I think that's one of the things. Certainly if you have mold allergies, many patients talk to me about, she's talking about outside mold. Many patients say, oh, I can feel the snow mold, you know, my sinuses are acting up. So that's a different thing. That would be more like a mold allergy. But it's not cooped up behind our walls hiding, where all those mycotoxins are spewing out into the air, you know, in your bedroom. So I think it's different. That's my understanding so far. Anybody else? Okay, well, thank you. Thank you for inviting me.